You may have many questions about the types of activities you can engage in after a knee replacement. One common question is, can I run after my knee replacement? There are many considerations and risk factors, so the answer is not a simple yes or no. There are no specific guidelines because of ongoing debates whether or not running is safe, who it is safe for, and how long after the surgery can you begin running. Some surgeons say that running is prohibited, whereas others suggest to avoid it. There is also a lack of research regarding the long-term effects. One study found that people are able to participate in intense sports for a minimum of 4 years, but that's because the assessment was 4 years after the knee replacement. If you choose to run after your knee replacement, you should be mindful of how soon after the surgery you are running, your technique, and your running shoes. There are also debates as to how long after a knee replacement someone can begin running. In one study, 10% of surgeons stated that running is allowed 6 weeks after surgery, and about 50% stated it is allowed 6 months after surgery. If you have any questions, always consult your surgeon. Not all knee replacements are the same, so consulting with your surgeon ensures you are making the safest decision.